Sometimes there's a little bit of a lag. So we'll let it sit for a few seconds. Okay. It looks like we are up and running. Good afternoon, everybody. My name is Hillary Highslope. I am the director with the Clewiston Chamber of Commerce, and I am joined today by folks from Henry Regional Medical Center as well as Florida Community Health Centers. And we just thought that we would get together today and be able to answer some questions and speak to the community about the current surge that we're seeing in our positive COVID-19 cases and what that's looking like from the healthcare side. And of course, things that we need to know as the general public and things that we need to, that healthcare needs us to do in order to help them. So with that being said, I'm going to ask Henry Regional if they would introduce themselves.
Hi, thanks for having us. I'm Electa Waddell. I'm the Marketing and Foundation Director for Henry Regional Medical Center.
Thank you, Electa. Welcome. And Nardina, if you want to let folks know a little bit about you.
Oops, it slipped back into me. Hi, thank you for having us on. My name is Nardina Johnson, and I am the Center Administrator for Florida Community Health Centers in Clewiston.
Okay, and Dr. Garofalo?
Yes, thank you for inviting us. I'm Dr. Garofalo, pediatrician and clinical director, Clewiston, Florida Community Health Center. I'm pediatric director too.
Okay, thank you so much for joining us. Let's start first and foremost with Electa. If you would, talk to us from the Henry Regional Medical Community or Henry Regional Medical Center. Sorry, I'm getting you guys mixed up. Standpoint about current CDC guidance. Sometimes, as a layperson that does not work in healthcare, it's been challenging, to keep up with what CDC is asking us to do and how we can best protect ourselves and protect our community from such high levels of community transmission. So can you talk to us a little bit about the CDC guidance?
Yeah, so like you said, the CDC is constantly making changes based on the best data and science that they have. I know COVID burnout is a thing within the community. We've been doing this for almost 20 months here within the healthcare organization and out in the public. As a healthcare agency, we follow and prescribe to the CDC. And, in terms of masking, they recommend masking indoors and outdoors if you're in an area of high prevalence, which not just Hendry County, but the entire state of Florida falls within the category of high prevalence. Social distancing, hand washing, these are all things that are infection prevention, control prevention. And then, exposure and quarantine. Right now, the recommendation is 10 days for if you've been exposed. If you can shorten that, if you are able to get a PCR test on day 5 or after and get a negative, to 7 days. And then, of course, if you are COVID positive, the 10 days of isolation, 24 hours, no fever, and your symptoms are improving. So it is changing, but it's based on science, and it's the best recommendations we have right now.
Right. It is an ever-changing, kind of ever-evolving situation, but I think that a lot of that is due in part to, it was just new, and we're having to be flexible even as a population, you know, having to be flexible and conscious of that. So Nardina, Florida Community Health, Dr. Garofalo, I don't know, you know, who is best to answer this, but like, let's say I was exposed to a positive case. How long would you guys think that it typically takes for you to show symptoms if you're going to?
Generally 5 days. We have to wait 5 days.
Okay, generally 5 days. So is it good to test prior to that or just?
If you don't have any symptoms, it's better to wait the 5 days before.
Okay,
Yes.
okay,
But if you
thank
have
you.
any symptoms and you have been in contact with someone who is already positive, you don't have to wait the 5 days if you're already having symptoms.
Okay, okay, thank you. So I understand you are, this wasn't on your, this wasn't on the list, but it's just something I'm curious about. You are a pediatrician. Are we seeing a lot of children coming in with COVID symptoms or?
Yes, it is alarming because in July, we only have like 8 positive cases. I'm talking about our clinic in Florida Community Health Center.
Uh-huh.
I'm not talking about all the clinic in Cluston.
Sure.
And in July, the amount of patients coming or calling for symptoms were small. And we only have like 8 patients that were positive. But at the end of August, we have positive, and counting only children, 108. From A, we went to 100A.
Okay.
Mhm.
Okay.
And
Thank you for those numbers.
For I think it's going to get even worse for next month because for one patient that you have positive, you expect to have 7 to 10 with the new variant.
Oh, I see. I see. So just that community transmission.
Mhm.
Okay, thank you. And Electa, you mentioned like sanitizing and washing your hands, or maybe you said washing, but hand sanitizer is still a good method of, you know, like I send my kids to school with their lunchbox and it has a hand sanitizer on it. And that's still a good method to make sure we keep our hands clean, right?
It is, as long as it has 60% alcohol or above in it, it would suffice as a good way of cleaning your hands. You know, if you have the option to go and wash your hands with soap and water, please do so, and try to do it as much as you can, so. But
And so-
60% alcohol is the level you want to see in a hand sanitizer.
Okay, perfect. Thank you. And that's good to know, you know, when you're looking at like people making homemade hand sanitizers and, you know, you're just kind of like, oh, I don't know if that's going to be effective. Nardina, from the clinic's perspective, not necessarily for peds, but what are we thinking? What's the best way to prevent COVID, to keep yourself safe? Like I said, not necessarily for peds.
Okay. Well, keeping your hands clean by washing them or with the hand sanitizer. Wearing a mask is very important
Okay.
when you're out in public, and that's indoors or out if you are close, you know, in close proximity to others.
Mhm.
So, and then being vaccinated as well is an added layer.
Okay. Okay. And I know, you know, some of our school age children are eligible for that vaccine, obviously, and then some of them are not. So that's where we would like to, you know, try to implement these other mitigating factors that we can, even from a, you know, like your personal choice type situation where you can choose to send your kids to school, you know, how you see fit. So you say we should be wearing face masks when we're in public. Yes, ma'am. Dr. Garofalo.
I think the most important aspect to control decrease the transmission is the use of masks. And we are really upset that it's not mandatory right now because this is a virus that is transmitted by droplet. And the only way to avoid that is using the mask, because that also gives you, even if you are breathing a little bit, it's not too much. and your body maybe have the chance to defend against the virus. But when someone is not using the mask and is another sick person going around and you get all, it's more difficult, especially if the person has not been vaccinated, to respond with an immune response that it will kill everything that went inside. So the most important aspect the most important is that everybody use the mask. And it's not that we want it because just, the pleasure of doing something mandatory. No,
Sure.
it's really necessary because there are people who have less level of education. We have to help and we have to protect our children. Even if their parents consider that it is not important, we have the proof. We have the evidence-based medicine that is better for them and they are more protected using the mask. So
yes, ma'am. And I understand. And I think that's a lot of the reasons why when we sat down kind of in-house with our chamber team and looked at the possibility of doing this, and we wanted to get it out in a timely fashion because COVID was becoming an issue, once again, for our second surge. I would say even a more prevalent issue than it was the first time around, in my very unmedical opinion. I just being a resident, that's what I see.
Mhm.
But the
Well,
goal was just to get people to have these conversations and get this information out so that folks can make the best decisions that they can make.
Well, and
So
I think a reminder too is, a symptomatic person is contagious 48 hours prior when they don't have symptoms.
Right.
For that 48 hours before they're even symptomatic, they're out, they're doing their normal day-to-day things. You may have the opportunity to run into them where that masking protocol, social distancing, and washing of your hands and those things really are critical, because those individuals don't know that they are contagious right now, nor do you. So that's why these things are important. It's not just when they have symptoms, that those 48 hours before are also critical too.
yes, yeah, that's a very good point. I mean, when you bring in the component of being contagious 48 hours ahead, that's a big point for sure. Thank you. What is Nardina, what is the current positivity rating in Hendry County today? And can you explain like how that's formulated? Does that make sense?
The last thing I think I read, it was like 28 to 29% positivity rate for Hendry County. But if I'm not correct on that, Electra or the doctor can correct me with that. But that's handled by the Department of Health.
Yeah, I'll pull up the sit rep report from today.
Okay,
29. It's 29.
Okay.
Mhm.
Okay, thank you. And we report directly to the Department of Health through all of the laboratories, and then they calculate the numbers. And at this time, they are providing information weekly.
Okay. Okay. And how is that number determined? So the 29%, I know sometimes people think that's 29% of our population, and that's not the case.
No.
Would somebody like to explain that?
That's 29% positivity rate of the tests done. So
Okay.
if there was 100 tests, then 29 were positive.
Okay. Okay, perfect.
And in correlation, last year when we were going through the whole reopening process, the goal for reopening was under 10%. So take that into account when you look at our 29% as a county. When the reopening was, the goal was under 10, where we're at now. So it's been very significant. It's been over 150% higher than the prior peak, what we're seeing here in the county and the state. So,
well, and I think that's a fair point too. We had a small event, if you will, planned for week before last, I think. And we reached out to Hendry Regional and, not you, Electa, but someone else, and asked for a little bit of guidance. And we're told that it's not a very good idea. And we took that advice and decided to postpone, what we had planned, because we had seen a couple of events take place locally, and it did lead to quite a bit of transmission. And we just kind of felt in-house like the responsible thing to do was to wait, so. What are some of the most common signs, Dr. Garofalo, that we're seeing in individuals who test positive for COVID, whether it's the original variant or another variant? Like what are people looking for?
Okay. Fever. I will mention all of them, but some patients only have one or two symptoms. Not everybody
Okay.
has all the symptoms. So I'm going to mention all of them. Fever, headache, muscle pain, new loss of taste or smell, vomiting, diarrhea, chills, fatigue are the more frequent.
Okay.
With the new variant, we have seen that more like headache, runny nose, cough, and severely sore throat. But that doesn't mean that it's not exactly that like this.
Sure.
Yes, but that is the most humans with the new variant at the beginning.
Okay. Okay. How, as we go into, just the general flu season, how would you help people identify between, oh, I think I might have COVID, or I think I might have the flu, or do they just come to test regardless?
Yeah, there is no way to differentiate. And the safe is we are in a pandemic, and it's better to rule out the worst. And okay, if it's not COVID, we will deal with what it is. But just because someone tested for influenza and now you have the symptoms, it's better that you get tested and rule out that you have COVID. Because if that person has COVID and is not identified, it's at risk later that it could get complicated and we don't know soon enough that it's COVID, but also the family and friends are at risk. So it's better if someone have cold symptoms. Now we don't know. There is no way to know if it's influenza or COVID. The recommendation is to rule out COVID first.
Okay. Electa, what is the best way that the hospital is telling folks to treat COVID when they can remain at home?
So you're going to be treating your symptoms. If you have a fever, you're going to be taking a fever reducing medicine like Tylenol. Lots of fluids, lots of rest. At that point, you're just treating your symptoms. I would say, if you start having trouble breathing or persistent chest pain and confusion or inability to wake up and those symptoms increase, that's when you're going to want to go ahead and re-seek medical care through your provider or the emergency department or what that is. But if you are able to stay home and use those over-the-counter medications to treat those symptoms that you're having, I mean, that's the best answer we have at this time because it is a virus.
Okay. Nardina, do you guys have sort of like a
Hillary.
Yes, ma'am.
Oh, could I add to that?
Absolutely.
For the patients, because the ER at this time they're so busy. Patients really should call their primary care physician as soon as they have symptoms. At Florida Community Health Center, we are testing 5 days a week, so they could call our office to be tested. And then that way, or even do a telehealth visit. So we're doing virtual visits, but we ask them, please do not come into the office. But if they give us a call, and the best way to handle it is to go ahead and call us, at the onset of any symptoms. And then the doctor can determine, the next step, but to try to keep them out of the ER if it isn't necessary.
100%. And that's kind of where all of this is leading, like what do you guys need people like me, just not healthcare minded, like just regular folks, what do you need us to know and what do you need us to do in order to help you? Go ahead, Dr. Garofalo.
For example, it is important for everybody to know in what case they have to go to the emergency room. Now, a lot of patients are measuring when they are sick, the oxygen at home. So it is important if they are doing that they don't take it just a little bit, 88, and they go to the emergency room. They have to put the equipment for an entire minute and wait. And if after a minute is less than 90, that is a reason to go to the emergency room. If they have COVID symptoms and they have less than 90, it's a reason to go to the emergency room. If they are having shortness of breath, like they cannot make full sentence, that they are having problem going from the bedroom to the bathroom. That is what we call shortness of breath difficulty. They should not wait at home that is a reason to go to the emergency room or even call 911.
Okay.
Not for fever, no, because this is the other reason. We ask the population not to call the emergency room if it's not really an emergency. If the kid has fever, but is breathing normal, is not agitated, is talking, is not a reason to call the emergency room because that ambulance is needed for another person. So the reason to call the ambulance is shortness of breath. As I mentioned, the oxygen is low.
Like just really life-threatening.
Yeah. And if other symptoms, call the primary doctor. We do telemedicine. We try when a patient have COVID symptoms to do it on the same day, the telemedicine, and I'm sure the other doctors are doing the same.
Okay.
Yeah, and just, from emergency room perspective at Hindley Regional, there was a couple days where we had to go on what's called diversion, which meaning we will not take in any more ambulance. And we're a 10-room ER with treating 26 people in there. So, we really were being overrun. While we had a lull past couple of days, it is starting to pick back up. And with staff shortages, we don't have our ICU open. We're having to treat our ICU patients in our ER. So that takes up even more. So what we are finding a lot of people coming into the ER for is the testing option. And like Nardina said, they have testing opportunities throughout the week. We can do rapid tests at both of our clinics in LaBelle and in Clewiston. Monday through Friday, we do PCR testing at 1 o'clock, drive through in your car. So those testing options, if that's what you're seeking, there's plenty of opportunities within our community to get those done. They are free. And it will cost you a lot less than going into the emergency room if that's what you're seeking as that testing component. And we're turning around those tests, on a PCR fairly quickly as well. So,
Okay. Dr. Garofalo, can you talk at all about one's ability to kind of bolster their own immune system, ahead of having COVID, just to kind of give your body the best chance, or even helping your kids build their immune system up to respond properly?
There are a lot of things that we can do to boost our immune system, but remember that we no guarantee that they don't get COVID. The only thing, and I will talk about it, but the only thing that can protect them at this time is that they get the mask, that they use it full time, only remove it at lunchtime and be separated 6 feet from another kid. And also when the adults around them get vaccinated, we are helping them. That is the best way at this point. So even when I'm going to respond, I don't want people to get confused. So
That's fair.
How can you help to improve the immune system? Giving a healthy diet, doing exercise, reducing the stress. For the people, older people, do not smoke. Try to have a healthy way and if you have chronic condition under control. but I don't want to say take vitamin C or get this supplement, because maybe it will create confusion and they will go and get the supplement, when the most important thing that we can do to help our children right now is to reinforce the use of the mask and hand washing, but more than anything, the use of mask and to keep the distance from other 6 feet.
Okay, thank you. And I'm not sure who wants to take this question, but just asking a little bit about variants. And, I know I'm halfway familiar with, like the original, I guess would be Alpha, I don't know. And then, the Delta variant. I did hear on like some news outlet the other day that that's primarily what we're seeing in the United States right now as a whole is Delta. And what are your thoughts moving forward from here?
There are a lot. There is, I even have to write down the Eta, Lota, Kappa, Latva, and most recently the Mu. And the Mu is already in California. But the most concerning about this new variant is that, for example, now that we have been using the antibodies as a treatment, they have seen that it reduced the effectiveness, that the resistance that is not responding to that treatment. So the most important, and for that reason, the most important is to avoid the disease and avoid the cause and know how are we going to treat the symptoms, or how are we going to treat the person when it is already sick. That is important. But as a community, what we can all do, and we have access, it doesn't cost anything, is that everybody use the mask. And it's no, I don't know why this, something that is so important, is have politics. I don't understand. I don't even understand why the governor is not making this mandatory at this point that the infection is so bad.
Yes, ma'am, I hear you. Electa, tell us, and I appreciate you, weighing in, and I can tell that that's something that's weighing on you. And folks need to hear that. That's okay. Electa, tell me a little bit about the different vaccines that are available through Henry Regional, and then also directing folks, like Nardina, do you guys offer vaccines? Let's talk about that.
So at Henry Regional, we offer the Moderna vaccine. So that's the mRNA vaccine, and it is 2 doses, and the second dose is done 28 days later. Here, after September 20th, we will start the process of offering the booster shots as well. I know through, I think CVS has Pfizer. Nardina, I'm not sure which vaccine you have. I know
We have all 3.
You have all 3. Okay. Yeah, I know the Department of Health also has some sites that come out and offer all 3. So I know the vaccines are readily available out in the community. We do vaccines weekly, both in LaBelle and in Clewiston. You can easily get those. So, that is the greatest defense against hospitalization of COVID is vaccine. 98% of those people that are being hospitalized within Henry Regional do not have their vaccine. And that's the reality of it. They're not vaccinated.
Okay. I know, a lot of our local pharmacies are offering, K&M, CVS, Walgreens, something just for viewers that I would like to make sure that I touch on is, if you don't follow Hendry County's Facebook page, be sure to do that. I know that the PIO for Hendry County is updating, when they're going to have, mobile testing or mobile vaccination, things like that. So you can get a lot of good information there. At this time, am I correct that vaccination is still only for 12 years of age and older? Okay,
Correct.
okay. Dr. Garofalo, do you have any kind of indication that that will go down, that age limit?
It will, but there is still no, we don't have a date, but it will happen. Mhm.
Okay,
They
okay,
are making a study even with 6 months or older, but it's not approved yet. It's going to take time.
sure, sure. Nardina, what would you tell somebody, you know, now that we've moved on to like the vaccine portion of the conversation, what would you tell somebody to expect upon getting vaccinated? I'm gonna
Hillary, we have
have a drink,
different
sorry.
reactions to the vaccine. Some experience soreness in the location that they received the vaccine. Others may have a mild fever or chills, something similar to flu-like symptoms, but everything we've experienced with administering the vaccine, the symptoms have been mild. Dr. Garofalo maybe could shed more light on that as well.
No, it's like you described, they have been mild. Mhm. And the most frequent side effect is pain on the side of the injection and a little bit of swelling, but that could be avoided or at least decrease the chance of happening if immediately after they receive the vaccine, they put an ice pack for 10 minutes. It really makes a difference.
Okay, okay. And now, Dr. Garofalo, you talk about masks. Vaccinated people, should they still be wearing masks?
Yes.
Let's just like clarify, you know, there's just, like we said earlier, it's just been this constantly evolving, very fluid situation.
Yes. Especially because the immune system, and going back to your question, because you was asking how to boost your immune system. Vaccine is one of them, and it's very important in this case.
Okay.
Because when you receive the vaccine, your immune system, you know, it will get ready to fight COVID if you get affected. It is important to continue using the mask because you could still get the disease, and also especially when you have not received the second dose yet, because your immune system, we expect that will be ready to fight 2 weeks after the administration of the second dose. But even before, it's already proved that patients that have only received 1 dose and they have been sick, they don't end up in the hospital, like is happening with the patients that have not been vaccinated. So
Okay.
I don't want that people get discouraged. Why I'm going to get the vaccine if anyway I have to use the mask? It's better to do both.
Okay.
But you are more at risk if you don't get vaccinated. So if it's someone who totally hates the mask, and that person has to go in the line first for the vaccine than anyone.
And now
the vaccine isn't a cure. You know, I think a lot of people think that, oh, I'm never gonna get it. You know, the vaccine was not created as a cure, it was created as a way to keep hospitalizations out. And its efficacy is 95+% for them, you know, especially the mRNA ones, to keep people out of the hospital. And that is what we're seeing in the hospitals. Those that are being hospitalized are not vaccinated. So it is working, it is doing the job that it was meant to do, but it was never touted as a cure. And I think that's where confusion lies.
And another thing that is important is to try to get vaccinated as soon as possible when you are healthy, when you don't have any symptoms, because we have seen patients that, for example, the father in the family died because of COVID. So suddenly everybody at home or in the family get scared and they want to get vaccinated. But in that case, it is important first to rule out if they have COVID, they should not get that vaccine at that moment. They have to recover first and they have to wait. They cannot go, if someone has been diagnosed now, they are dying, go immediately and get the vaccine to avoid, because you don't know, they don't know if they are sick. So the first thing is to rule out, and we have seen that.
Okay. And that was going to be one of my next questions. So if, you know, Susie has had a positive COVID test, she has since recovered from COVID and she's okay. Do those folks still need to get vaccinated?
They can get
And at what
vaccinated
point is it safe for them to do that?
if they didn't receive antibody treatment. I will say 1 month, 2 months, they could get it if they were not complicated. But the one that received antibody treatment, they have to wait 90 days from the date that it was the last day that was administered before
Okay.
they get vaccine, because if not, it could not be effective.
Okay. You bring up the monoclonal antibodies. I'm just going to kind of look away from you guys for a second. I had a comment on our Facebook from Raymond Iglesias. He is a Hendry County Commissioner. Recently, I had COVID and had the Regeneron treatment through outpatient at Hendry Regional. The staff was amazing, and I feel the treatment was the reason I did not get any worse when I began having breathing issues. How can we help spread the word that this treatment is available to prevent hospital stays? So that's a great question, Raymond. And I'm going to ask you guys, even though it wasn't technically on our paper, if we can talk a minute about the monoclonal antibodies and Regeneron, all the different names that it has, because, you know, folks need to know that this is available to them.
That is the important for them to contact the doctor, the primary doctor. Based on the symptoms, the doctor will decide if they need it or not.
Okay.
So I think that decision should be made based on the characteristic of the patient and the clinician. What they should know is that it's available, and it is important not to wait because it's more effective at the beginning of the symptom.
Mm-hmm.
So Electa, even when we don't do it, we let them know where are the center located.
Right, absolutely. Because I know there are lots of sites that are stood up around the state, you know, state funded state sites. The governor has been on the news as of late talking about these monoclonal antibody sites. It is something that we're offering at Hendry Regional. Can you tell us a little bit more about that?
Sure. So we do offer the Regeneron treatment, monoclonal antibody treatment here at Hendry Regional. We do follow, because it is approved under emergency use authorization. We do have protocol and criteria you have to meet. Like Dr. Garofalo said, part of that is a physician's note. And for us, it's an outpatient treatment that is done via infusion, and it takes about 3 hours. So the infusion's about an hour, but we watch you an hour after, and obviously we're watching you prior as well. So that's a little different because we have certain criteria we follow, whereas the state, which is also using Regeneron, those state sites, their criteria is different. I'm not even sure what that is. But,
yeah, it seems that there's very little criteria.
Very little criteria, yes.
Sites.
On those state sites, which are in our coastal communities surrounding us. And while they're doing Regeneron, it's actually 4 shots. So 1 in each arm and then 1 in each side of the stomach. And so that's a little bit different, but we are offering it. And anyone that calls the hospital 902-3000, you are able to, you know, speak to the outpatient services about that. Our website also has the criteria listed on it under our COVID-19 tab, so you can pull up.
And I've seen it on your Facebook page.
Well, before it got taken down by Facebook.
Oh, that's right. That's right. Well, Electa was threatened with Facebook jail.
Yes.
So we don't want to see the hospital drop its Facebook page. So you better be careful.
Hillary.
Yes, ma'am.
Hillary, I definitely think that is great that they can get the treatment. But if we could remember, an ounce of prevention is worth a pound of cure. So if we can prevent them from getting it, wearing the mask, or even lower the symptoms by having the vaccination, that's what we really need to, you know, push it. It's awesome that we can treat it, But if we can prevent it or decrease the risk, then I think that should be our first line of choice, is to try to prevent it.
Yeah, and I absolutely agree with Nardinia. The monoclonal antibody treatment, while it's great and it has about a 70% effectiveness for keeping individuals out of the hospital, it is not a substitute for vaccination against COVID-19, as well as the other protocols that we know work. So I couldn't agree more.
Okay. Well, just looking through the Facebook feed, we had a paramedic comment that this individual can 100% tell the difference between a vaccinated versus unvaccinated COVID patient. We have folks chiming in, supporting vaccines and masks. And I want to encourage you guys, this is on just speaking to the three of you that are on the call with me. This is on our the Clewiston Chamber of Commerce's Facebook page, and I want to encourage you to maybe like monitor it. The chamber obviously is not going to be giving out healthcare advice. I just like to bring you guys together to do that for us. But if you'll just continue to monitor it, because I'm hoping, the hope is that folks will continue to go to this video and watch and post additional questions maybe this evening when they get off of work. I understand we're doing this at 1 o'clock. People are at work. It's hard for them to kind of be on Facebook while you're at work, and I get it. So it'll stay there and folks can go back and watch it. And I would like to be able to kind of assure them that if they have questions tonight, that they can still post them there, and our healthcare community will be kind of monitoring that and will answer to the best of our ability, your ability, obviously, some of those questions and concerns that they might have. So I want to thank you guys for joining us, you ladies for joining me, and leave you guys with the opportunity to, like, I'm just saying a general thank you to you, to the community for watching and supporting the Chamber of Commerce, but then letting each of you have an opportunity to kind of close us out with how can we as residents, as business owners, as parents, all the many different hats that each of us wear living in this community, how can we best help you, our healthcare providers? And what are some of the most important things that you need us to know? We'll go Electa. I'm just going from my screen. So it'll be Electa, Nardina, and then Dr. Garofalo.
Well, first, thank you for giving us this platform and opportunity to speak
Absolutely.
to the community. We enjoy the opportunity to do that. I really think it's important for people that have symptoms or people that were, exposed and are in quarantine to really respect that and, seek that medical care appropriately through your primary care physician. Again, we have 2 rural clinics, one in Clewiston, one in LaBelle. Both of those offer vaccination opportunities. They offer rapid tests, PCR tests, so your testing and all of that treatment's there. Of course, we have the emergency room for those that need it. And just really continuing to, I know COVID burnout's a real thing, but, masking and the hand washing and the social distancing and vaccination, I mean, those are really important things. And we're seeing that reflected of those who are hospitalized, that those things aren't happening. And so that's where they're ending up. So we don't want that for our community. And just know that Hindley Regional is here for everyone. And if I can help in any way, I'm happy to do so. So thank you again.
Thank you. Nardina?
Yes, Hillary, thank you so much for having us today. I think more or less, I'm thinking about our liberties and freedom. We do have the freedom to not wear masks, but we should be careful not to allow our freedom to cause injury to someone else or to imprison us to where we can't get past COVID. I would love to be able to travel and be out, but for now, we have to be safe and vigilant. wear our mask. If you are able to be vaccinated, please get the vaccine. And remember that we are our brother's keepers. So now if you need medical care, we do provide telemedicine. You could call our office at 863-983-7813 for testing or even for appointments for vaccines. So Florida Community Health Centers, we are here to help our community. Stay safe.
Great. Thank you, Nardina. Dr. Garofalo, I've actually never had the pleasure of meeting you, so it was lovely to meet you.
And so thank you, Hillary, Electa, Ms. Nardina, on the community, the one that are listening and paying attention to what is going on and what we can do. And your question was what we need from all of you. I think the first thing we need, I'm a pediatrician, so I'm asking with my heart to the teachers at this point to be a leader, to use the mask and to fight for the health of our children. And the best way to do it now is ruling by example, because I have seen patients that the mother are telling me, doctor, they go with the mask, but the teacher is not using the mask. And this, I see the same history, the reverse, no? Oh, in my classroom, all the children are using the mask. All his friends are using the mask because the teacher is telling them to use the mask. Teachers are leaders, and whatever they say, the children will follow. So what I'm asking is, even when the government says that is not mandatory, you can still stimulate your employee, not just the children, everybody to use the mask, because it's the best now, it's the best that we can do to protect our children, for them not to get sick, because they don't have the option to get vaccinated. And the other thing is that adults try to get vaccinated. I know the vaccine has risks, but the benefits at this point are a lot more than the risk. And life is a balance, and we have to decide. And sometimes we take the decision not for us, we take the decision for the people that we love. Maybe they are at home and they are not aware what is happening, but Cluston at this point, like Electa, like you have been, like we have been telling them, is in an emergency. We see an incident that is alarming of the transmission, and it's not just the teacher, it's the owner of a business, a small business. If they make the mask to, for example, Walmart, I heard from my parents, doctor, yes, they are using the mask in the school, or we are trying to stimulate the use of masks, but when we go to Walmart, everybody's touching everything, nobody's using the mask. Right now, Cluston has an emergency. Everybody should be using the mask. If that is the best way they can help. Using the mask, getting medical attention as soon as possible, because sometimes they go too late. And now we even have the option. We do telemedicine, and we even have the option that is close the antibody. But remember, with the new variant, even the effectiveness of the antibody is reduced. So,
When you say new, you're not talking about Delta. It was the
no, it's not Delta. It's the new that are coming, but they are already in California.
Okay.
When they are in another place, they are coming to us. So it's better to do prevention.
Okay. Okay. Excellent. Thank you, ladies, so much for taking time out of your day to join us. And I'm hoping, like I said, that this will remain a little bit of an active conversation on the comments thread. So I do encourage you guys to kind of follow along there and just help us. And guess what? If you don't, I'll just tag you and kind of call you out and make you help us.
Another thing we can say, we have been very busy because of the amount of patients is so much that sometimes we even go home 9.
Wow.
So if you don't see that we are more active there, it's because we are really taking care of patients.
Sure. No, I'm just
It's free
I'm
to
not really gonna call
now
you
we
out
are
on
going to
Facebook.
respond, but that is the reason we are not.
Yes, ma'am. Yes, ma'am. And we as a community really appreciate all the hard work and long hours that we know our healthcare community is putting in. And I think that's a lot of the reason that we decided to move forward with this, was just to see if we can get some information out and to just show our appreciation for all that you guys are doing. So thank you so much. And I hope all of you have a great day.
The same thing.
Bye.
Bye-bye.
Bye, thank you.
Bye.